Hi everyone, Dr. Carling here to talk about adrenal tumors and high blood pressure. Adrenal tumors and high blood pressure. So let's get straight to it. Not all high blood pressure is just hypertension. Adrenal tumors like those causing primary aldosteronism, PA or Conn syndrome, Pheochromocytoma or Cushing syndrome can often be the hidden culprit, and we need to catch those tumors that are drivers of the high blood pressure. So at the Carling Adrenal Center, we focus on curing patients by removing these tumors. We're not interested in masking symptoms with just one blood pressure pill after another. Always consult your medical doctor for treatment options. So here are 3 key points to understand. First, every patient with high blood pressure needs to be screened for an adrenal tumor. I'll say that again. Everybody who has high blood pressure needs to have an adrenal tumor either ruled out or ruled in. So these tumors can overproduce hormones like aldosterone, methanephrine or adrenaline type hormones, or cortisol as in Cushing syndrome. And all these hormones drive the blood pressure in ways that just treating with medications will miss. So up to 20% of patients with high blood pressure can be linked to an underlying adrenal tumor with primary aldosteronism or Conn syndrome, as well as Cushing syndrome, the 2 most common causes. Of course, they cause a lot of other issues except high blood pressure. They cause weight gain, diabetes, atrial fibrillation, heart attack, stroke, and early death. So screening is critical to avoid missing these very treatable causes of high blood pressure. Second, let's talk about how screening is done. It starts with a simple blood test to check hormone levels. So for primary aldosteronism, you check aldosterone, renin, and potassium. To rule out the Pheochromocytoma, you check the adrenaline type hormones, those are called methanephrin. And for Cushing syndrome, you need to check what's called a dexamethasone suppression test that measures your cortisol, as well as the ACTH, which is a pituitary hormone, and the DHEAS, which is another steroid hormone. A key test for primary aldosteronism is the aldosterone-renin ratio. And if you then have evidence of hormone overproduction, the next step is to get the Adrenal Protocol CT scan to find the tumor in the adrenal gland. So it's very straightforward. Do the labs first, figure out if you have overproduction of any of those hormone levels, and if you do, then you get the CT scan. Number 3, very important point. Don't let your doctor just treat you with one pill or medicine after another without figuring out why you have high blood pressure in the first case. The medications can control the symptoms, but they're often just a band-aid when you have an adrenal tumor as to the root cause. And the surgery, removing the tumor, makes perfect sense, right? Is the only curative treatment and the gold standard to cure these cases. So don't mask and just treat the symptoms. Get to the root cause of why you have high blood pressure and get cured. So at the Carling Adrenal Center, we prioritize curing patients through expert adrenal surgery, not long-term just medication management. So talk to your doctor to ensure that you're screened properly. And thanks for watching, and stay intellectually curious. Thank you.